Pupil examination is an essential part of the neurologic exam. Pupillary changes are considered early indicators of neurological change, and yet, are often undetectable using traditional manual assessment methods. Manual pupil assessment is subject to compounded sources of inaccuracies, and can result in as much as 39% inter-examiner variability and error. The NPI 300 Pupilometer is a handheld automated device that provides accurate, reliable, and objective pupil size and reactivity data independent of examiner, removing variability and subjectivity from the pupillary examination. Most importantly, the NPI 300 Pupilometer expresses pupil reactivity numerically, as the Neurological Pupil Index (NPI). So for the first time ever, both pupil size and reactivity can be trended for changes, just like other vital signs. The most effective way to use the pupilometer is to establish the earliest possible baseline measurement, when the patient is admitted to the intensive care unit, emergency department, or any area of the hospital where a neurological exam is performed, and then trend for changes over time following your standard pupil assessment protocol. By removing subjectivity from pupillary evaluation, the NPI 300 Pupilometer provides benefits to clinicians and patients through its ability to detect subtle pupil changes, and to trend these changes over time. The NPI 300 Pupilometer system consists of the NPI 300 Pupilometer, the NPI 300 charging station, the power adapter and plug, and the smart guard. Connect the NPI 300 power adapter to the NPI 300 charging station and plug into a power outlet. The indicator light at the base of the charger will display a white color to indicate power has been established. Then place the NPI 300 into the charging station. The indicator light will turn blue, indicating the pupilometer is charging. The indicator light will turn green when fully charged. Upon being placed in the charger, the NPI 300 will initially turn on. When not in use, it is recommended the pupilometer remain seated in the charging station. After 5 minutes in the charging station, the NPI 300 will go to sleep to efficiently charge. The screen will go dark. To use the pupilometer after it has gone to sleep in the charger, simply remove, and it will wake up. After 5 minutes out of the charging station and not in use, the pupilometer will go to sleep to conserve battery life. To wake up the display, touch the screen or push any button. After 20 minutes out of the charging station, the NPI 300 will power down. To turn it on, press but do not hold the on-off button on the side of the device. Open a new disposable smart guard. The smart guard will be used on the same patient for the length of the patient's admission. Slide the smart guard onto the NPI 300 with the foam pad at the bottom. There will be an audible click when the smart guard is properly positioned. For the first patient use, the smart guard requires a one-time association of the patient ID. For subsequent measurements, the patient ID will be permanently saved on the smart guard, which can store up to 168 bilateral pupil measurements of the associated patient. There are two options for associating the patient ID to the smart guard. Using the NPI 300's incorporated barcode scanner to scan the patient wristband, or manually entering the patient ID. To scan the patient's wristband using the incorporated barcode scanner, select Scan Code on the screen. The NPI 300 will emit a white light from the top of the device. Center the light over the barcode until you hear an audible beep. The patient ID will now appear on the NPI 300 screen. Confirm the patient information is correct and select Accept. To input the patient ID into the smart guard manually, select Manual ID. Using the touch screen or keypad, input the patient ID and select the Enter icon. Confirm the patient information on the screen is correct and select Accept. The patient ID is now written to the SmartGuard RFID memory tag, and no additional scanning or manual entry of the ID is required. We recommend placing a patient ID label directly on the SmartGuard and keeping the SmartGuard at the patient's bedside. To begin the measurement, position the NPI 300 with SmartGuard at a right angle to the patient's axis of vision, minimizing any tilting of the device. Position the foam pad resting on the patient's face at the base of the eye orbit. Remember, the pupillometer's right and left buttons are oriented to the patient's pupil being measured. Press and hold either the right or left button until the pupil is centered on the screen, and the display shows a green circle around the pupil. A green frame around the screen indicates the pupil is properly targeted, while a red frame indicates the pupil needs to be recentered on the screen before the measurement is initiated. Once the green frame appears, release the button, holding the pupillometer in place for approximately 3 seconds until the results screen is displayed. Repeat the scan procedure for the patient's other eye to complete the bilateral pupil exam. When the bilateral pupil exam is complete, the NPI 300 measurement results will be displayed in green for the right eye and in yellow for the left eye. Following the completion of the bilateral pupil exam, the NPI 300 is defaulted to Open Results Page 1, displaying pupil size measured to the hundredths of a millimeter, and the NPI reactivity values for each pupil. Toggle the results page icons, found in the bottom right-hand corner of the screen, if interested in viewing additional pupillary measurement parameters and the pupillary light reflex waveform. To view the patient's previous pupillary measurements, press the down arrow button on the keypad. To return to the home screen, press either the right or left buttons on the keypad. The Neurological Pupil Index (NPI) quantifies pupil reactivity on a numeric scale from 0 to 4.9, so for the first time ever, reactivity can be trended over time just like other vital signs. Now, instead of guessing that a pupil is reacting as brisk, sluggish, or non-reactive, pupil reactivity is expressed numerically as NPI. The closer the NPI is to 4.9, the more normal or brisk the pupil response. As the number declines, the pupil is becoming more abnormal or sluggish. An NPI of 3 or higher is considered a normal or brisk response, while an NPI less than 3 is considered abnormal or sluggish. An NPI of 0 signifies a non-reactive, immeasurable, or atypical pupillary response. Additionally, a difference in NPI between the right and left pupils of greater than or equal to 0.7 may also be considered an abnormal pupil reading. NPI is the only accurate and objective measurement of pupil reactivity in many common critical care scenarios, including in the presence of opioids, neuromuscular blocking agents, and sedatives. Most importantly, it is best practice to establish a baseline NPI measurement upon admission and trend for changes over time via your standard pupil assessment protocol. Select the trend icon from the home screen to view a summary of measurements on the attached patient's SmartGuard. Then, tap anywhere on the NPI summary table screen to view a trending graph of the patient's NPI and size measurements. Normal NPI trends can be identified by NPI values consistently above 3 with no continuous identifiable decline from baseline. Trending NPI values with each neurological assessment also allows for the identification of abnormal trends, like the one shown here, where the right NPI begins to trend downward, deviating from the left. Abnormal trends are important to identify quickly, because NPI may be an early indicator of neurological worsening. Infrequent spot checking with the pupillometer increases the likelihood of missing important incremental pupillary changes. Using the pupillometer and NPI for baseline and routine assessments is best practice, and may allow opportunity for earlier intervention. There are now over 100 peer-reviewed research articles and scientific abstracts supporting the value of pupillometry and NPI in improving the quality of the neurological exam and enhancing clinical decision-making and patient care. Additionally, pupillometry and NPI are included in several clinical reference texts and national guidelines. For more information about the NPI 300 Pupilometer System in critical care, including instructions for use, educational resources, and pupillometry clinical references denoted with an asterisk throughout this video, please scan the QR code to the left or visit neuroptics.com/NPI300. To contact your local representative, email us at info@neuroptics.com.